Today I am going to teach you about the diabetes mellitus. So what is the diabetes mellitus? Diabetes mellitus is a group of the metabolic disorder that share the common feature of hyperglycemia. Why is it important to study the diabetes mellitus? Because it share three common pathies: the retinopathy, which leads to the blindness of a patient; nephropathy, which leads to the end-stage renal disease; and the neuropathy, which leads to the lower extremities amputations. How is it classified? Diabetes mellitus is classified into two major categories: the type 1 diabetes mellitus and the type 2 diabetes. And there are other minor form of the diabetes. These are include the monogenic diabetes, monogenic form of diabetes, gestational diabetes, or the lipoatrophic diabetes. Type 1 diabetes mellitus and the type 2 diabetes mellitus are the major form of the diabetes, and the monogenic, gestational, and the lipoatrophic diabetes are the minor form of the diabetes mellitus. How can we diagnose the diabetes mellitus? We can diagnose the diabetes mellitus by doing fasting blood glucose level. It should be less than 126 mg per deciliter. Random blood glucose level, it should be less than 200 mg per deciliter. And the OGTT. What is OGTT? OGTT is oral glucose tolerance test. If we give the dose of 75 gram of sugar to a patient, then after 2 hours we will take the reading. It should be less than 200 mg per deciliter. So it means the patient is a normal. It's not a diabetic. But these fasting, random, and the OGTT are influenced by the other factors, including the trauma, illness, infection, acute diseases, or surgery. Why the fasting blood glucose level, random blood glucose level, and OGTT are influenced by the trauma, illness, infection, acute disease, or the surgery? Because in the trauma, illness, infection, acute disease, or the surgery, the release of counter-regulatory hormones take place. What are the counter-regulatory hormones? Counter-regulatory hormones include the growth factor or growth hormone, glucagon, and epinephrine. These hormones will ultimately increase the blood glucose level. So, what is the authentic test, or which test give the authentic reading for the diagnosis of the diabetes mellitus? Is HbA1c, in which the glucose moiety non-enzymatically covalently binds to the Hb of RBCs, and it gives the estimates over the 3 months. Because the lifespan of RBC is 120 days.